Navaladi Shankar is a spine surgeon, orthopedist, and knee surgeon in Apollo Hospitals, Greaves Road, and has an experience of 25 years in this field. He completed MBBS from Al Amin Medical College, Bijapur in 1993, Diploma in Orthopedics from Sri Ramachandra Medical College, Madras, India in 1997, and DNB Orthopedics and Orthopedic Surgery from National Board of Education, New Delhi in 1999. He is a member of Tamil Nadu Medical Council and Indian Orthopedic Association. Few of the service provided by the doctor are knee osteotomy, laminectomy, ligament reconstruction, spinal fusion, and he has a team of physiotherapy and also for the sports injury rehabilitation. He is a member of Indian Orthopedic Association, Tamil Nadu Orthopedic Association, Indian Trauma Society, Asia Pacific Orthopedic Association, Indian Hip Knee Arthroplasty Society, and Indian Arthroplasty Society. He is an international trauma tutor. Dr. Shankar also holds expertise in laminectomy, lower back pain and neck pain treatment, arthritis management, and trauma surgery. He has been awarded as Best Doctor Award from Dr. MGR Medical University for endoscopic spine specialist, international trauma tutor, oxenium knee specialist, and for cartilage transplant. Now I request Dr. Navaladi Shankar to come on to the stage.
Hi, good evening everybody. I'm overwhelmed here. Thank Dr. Karthik and Mrs. Kavya and Srinivasan to giving this opportunity to talk about this, and we had discussion. I was just thinking so much of their future insights. I could look into the geriatric population and heard our Satyanarayan Raju talk. Satyanarayana means Lord Krishna. Sat and Narayana means that he is still living in consciousness, and he really took us deep into the palliative care, sir. It is very nice, touching talk, sir. So when you talk about musculoskeletal disorders, it's one of the major disorders in the elderly. About 160 disorders are there. I'm not going to go into all details, which is common, I'm going to speak. And as you become age, the musculoskeletal problem increases. What happens? Your cartilage, resilience of the cartilage goes down, your bone mass decreases, your muscle power goes down, the ligament loses its elasticity, and the joint becomes stiff. That means all your muscles, bones, ligaments are not able to do even a normal function like joints to move the joint function. That's good, you get these problems. It's a musculoskeletal problems. So I like this when you're talking about the old age. Of every old people we meet, a lot of geriatric population, they always tell me old age is always 10 years older than I am. So that's what I like this. Although we say the old is gold, but a lot of impurities in gold also we have. That's where we have to look into it. Karthik has touched a lot about this elderly people, how from 2020 to 2050 it's going to be double, from 12% to 22% he was telling. And as you know that almost 1.71 billion people are affected by these conditions every year. And out of that, 568 million people suffer for low backache. Although in India, we are self-sufficient, but abroad, if you see, most of them is insurance care provider and a lot of burden to the country and economy. So today, just briefly, we are going to talk not much into details. I'll start from head to toe, starting from, as a geriatric caregiver, most of them will know. Starting from the head, is a common cervical spondylosis is the commonest things which you come across, which has the patient presents with neck pain or the pain radiating both the legs, is all both the hands. It's all related to the spondylosis because of the weakness of the bone and muscles. So what are the symptoms? They present with you stiffness, paresthesia, limited motion, and pain. These are the category of the symptoms usually the spondylosis patient present with, and with these symptoms, all of them does not need hospitalization or surgery or something. Few of them will be treated with the medications. Commonest cause today is gadgets. Even elderly people, a lot of them are using the gadgets. You know that cervical spine, 7 vertebrae is not sufficient to take the weight of your head. And most of the posture is like this only. And we tend to see more of elderly patient with the neck pain, which is become the number one symptoms than the late of the things. And the second symptom is, I divide all of them into 3 sleepers. There are back sleepers, there are stomach sleepers, there are side sleepers. And whenever they are, whatever this type of sleepers, if they don't use a proper pillow when they sleep, you land up in this type of neck pain which has to be addressed. Simple, like when you sleep, if you're a back sleeper, please use a thin pillow, not a very thick pillow. And when you're a stomach sleeper, make sure that reduce the amount of head you turn. And when you're a side sleeper, definitely use a thick pillow. It's all depends upon the sleeper. It's not like one pillow fits all the size. Second common condition is a frozen shoulder. So what is frozen shoulder? Frozen shoulder is that's a normal shoulder joint which we. The pointer. Okay. The one side, other side is a normal shoulder joint, and once as you age, the capsule become thick and inflamed. The patient has severe pain. Starting, usually they present the freezing pain. Every day they say, night I'm getting out the pain, doctor. Morning I have severe pain, early morning pain, because the muscles all go into the spasm. And as you don't treat it, slowly there will be completely decreased range of motions, and all the movements of the shoulders are affected, so that your day-to-day activities are affected. You know, even putting a shirt, or for ladies even putting their regular innerwear, it becomes very tough. So it has to be treated. If you treat it, definitely there will be definitely increase in range of motion. It's just only a simple capsular stretch which is more important. Simple medications, heat or ice or exercises, and the latest is injections. It's not the steroid injections what we all speak about. We are going into orthobiologics. That is a platelet-rich plasma, where we take your own blood and remove the RBC, WBC, and the platelet-rich plasma, which is rich in growth factors, is injected in the shoulder. The commonest exercise, which I tell them for all your elderly patients, day-to-day morning, simple pendular stretch exercises, cross-body arm stretch, arm circles, shoulder flexion, towel stretch, the armpit stretch. These are the things which helps to stretch your shoulder capsules. If you do this simple stretching of the shoulder capsules, your frozen shoulder will disappear. You don't need to even visit us. Then coming from neck to shoulder to then elbow, it's a tennis elbow, which is very common. You call it tennis elbow. It is not that, because it's lateral epicondylitis. So whenever they have this injury, they usually say the lateral side of the elbow you have severe pain. It's called lateral epicondylitis. Commonly we suggest some music counterforce based. That means rest to the muscles which is taking part, and simple NSAIDs will help you. Symptoms is severe pain going down the forearm and wrist. Day-to-day task is very much affected for them, like holding a cup or turning a doorknob or shaking hands. Everything will be affected with this musculoskeletal symptoms. If it is less than 3 months, you can treat in primary care itself by watchful rest, all that. But if it is more than 3 months, please do not treat yourself. Send it to secondary care, people like us, where we can treat it with injections and release than the surgeries. These are the commonest things which I tell my patient with the elbow lateral epicondylitis. Just do some wrist flexion, wrist extensions, and the bar, the forearm pronation. See, these all are again the ligaments which has become static and stiff. You are loosening the ligament, loosening the capsules, and strengthening a muscle. That means preventing sarcopenia, which is very common in the elderly. Because of the muscle weakness, loss of muscle power, you get this. Then the next one. From there we are going to osteoporosis. Everybody is going to talk about osteoporosis, So osteoporosis, if you see, the one side is a normal bone, other side is osteoporotic bone. And when you call this osteoporosis, T-score. Everybody like to know what is T-score. T-score is nothing but you are comparing your bone with the young age people of that age. So when you call osteoporosis, minus 2.5 is a score. So why osteoporosis? As you age, your bone mass completely decreases, the quality decreases, there will become fragility, and then becomes the fractures. It's very common worldwide. It's a silent killer. So it has to be treated because silent killer, because it does not come with the pain. Most of the patient diagnose osteoporosis only after fall, after coming to this. It's common in women, especially post-menopausal, because of the estrogen deficiency. And as the age passes, in men over the age of 70, they get this male menopause or andropause or osteoporosis, what we call this, which has to be treated. So everybody, every woman after the post-menopause, after 55 years, please check your bone density and make sure you diagnose this earlier, so that you don't land up in this type of fractures. Because if you leave it, it just compresses, it goes into the fracture. One of them tells us, sir, I was 150 centimeter, 160 centimeter, now my height is reducing. Yes, it will reduce because of the compression fracture. They go into kyphosis, the height reduces, the bone collapses. Every 1 in 3 adult have fall every year. They come to our clinic. 20% of the elderly die within 1 year of the fractures. Yes, that is true. So it has to be prevented before they have a fracture. So commonest is the hip fractures. So hip fractures affect very much quality of all the patients. 1 in every 5 person have the hip fracture, and only 50% almost women, once they have a fracture, they spend just like 50% of the lifetime in recovering from the hip fracture, which has to be treated early. That's what. So don't think geriatric fractures cannot be treated. Geriatric fractures now with the increased implantation, like titanium implantation, like you have a locking compression plates, geriatric plates, geriatric orthopedic itself is a separate subject, where elderly patient after the fracture has to be treated immediately, so that we are putting back early, like hip replacement or fracture fixation. So don't deny the treatment for any fractures for elderly. It can be treated with modern anesthesia and local aggressive treatments. Early mobilization is a very key source, so that you prevent it from them, they go into the depressions. So we should be very careful. Athulya, when I was going into the Athulya's rooms and things, all these things I found there. So I found it there very geriatrically. Athulya is so much friendly. All these things, what is required to prevent the fall, further the fracture. So all things are available there. So it's really they're considered too much into that, I was thinking. Osteoarthritis, again, very commonest condition. People think osteoarthritis, okay, leave it. If I'm going to operate, difficult. No. It's one, I'll tell you, many orthopedic surgeries are there which may not be required. But this one conditions, you treat them by knee replacement, they have really a beautiful relief. So it's not all the patients elderly can have osteoarthritis. There are people who does not have osteoarthritis, they have really a social and active productive life. So I put treatment of osteoporosis non-pharmacological, pharmacological and surgical. Non-pharmacological, you can have strength training, weight management, and you have the latest is not the land but water-based exercises for the elderly, which I would like to inform Karthik, you should get a swimming pool in your Athulya. Water-based exercises is very good, because geriatric people cannot sometimes take their weight and walk. So water-based exercise is very useful for them to get into that, so that the movement happens in the joints. So the body weight is carried by the water, so it's very easy for them. Many painkillers and also the viscous supplementation and or the orthobiology is available if people does not want surgical treatment. Yes, many treatments are available for osteoarthritis, like intraocular steroid injections, or you have this viscous supplementation injections. The knee replacement, yes, if all the 3 joints are involved, you do the knee replacement. That's one of the really very good surgeries, so that they walk pain-free. Few benefits which not going into the details. So this is the most common low backache. Almost, as I was telling, almost 17 million people are affected every day with the low backache. Shall I tell you one thing? 80% of the population in your life definitely would have had a back pain. Out of which, we are talking about USA, not in India. So that's we won't talk about that. In India, good news I would like to tell you is 50% all of you will recover in 2 weeks if you take treatment. 90% definitely will recover in 6 weeks. Bad news is only 1% who will be chronically disabled. And ugly truth is 80% of hospital resource is drained because of this. So don't worry, most of the back pain is resolvable. It's all mechanical backache, just simple non-inflammatory drugs and physical exercises. When there is a neurological deficit is nil. That's what that one person has a neurological deficit, should not misuse that. It's a normal backache and land up in a bigger problems, and we have to do. Usually the elderly, the disc desiccates and it does not recover. That's the reason you have this backache, but as slowly you recover, then you recover very fast. At the age of 60, how they look, if they don't do proper back exercises, age 75, because of the osteoporosis, compression fracture, become kyphosis. There are many braces available to prevent it. And this is again a very minimally invasive technique called vertebroplasty, where the compression fractures can be treated with just small injection, putting a paste, so that increasing vertebral height, so that you don't lose your height in the future. So management of back pain, early return to work is very important, and which we won't go into the details. And physical therapy is very much important. As you know, you walk, endorphins are secreted, so that you get back earlier. We are not going much into the details. And yes, food for elderly patient, I will always tell that most of the anemia, as you was talking about, you have non-heme products, heme products, non-heme products, you have this, all these are vegetables, and you have this fish and all cheese. It's all very much important. Calcium rich based food is very much required. As an elderly post-menopausal woman, every day they will need 1.5 grams of calcium and 800 units of vitamin D3. So diet is very important source. If it is not there in your diet, please supplement to prevent osteoporosis. Sarcopenia, again, it's one of the biggest. Everybody is talking about osteopenia. Yes, now you are talking about sarcopenia because your muscle mass will decrease. So simple weightlifting exercise is very important for elderly. Otherwise, that is the one which helps to increase your muscle mass. This is again one of the biggest factors where you have to take some protein along with the vitamin D and omega-3 to increase your muscle mass, and do some weightlifting exercises. It's not simple walking. Simple weightlifting exercise of 1 kg also will increase your muscle mass. To prevent sarcopenia, you have to do some type of exercises, because at the elderly age, chronic disease will be there, malnutrition will be there. There will be difficult, so much cell things, immunosense is happening in the cells. All will lead to sarcopenia, which you have to do. Second, last one more, it's a gait cycle. The gait cycle, locomotor dysfunction immediately disappears, acute in the form of fractures, they don't come back. Chronic stages different, acute stages where the gait cycle is very important, and you have to, by seeing the person, we will know what is the problem he is going to have. We should definitely concentrate and make sure that he prevent from unsteady gait to steady gait is one of the important things. So I will put the last slide, Kavya, Srini and Karthik. So I feel that Athulya is striving for a world in which people can live long and healthy lives, including long-term care and services and supports when needed. These are my things to say. Thank you, opportunity for.
Thank you, Doctor, for taking us drive towards the musculoskeletal issues. I kindly request Mr. Srinivasan, CEO, Athulya Senior Care, to present a memento to our speaker, Dr. Navaladi Shankar. Any questions or any discussions? Thank you, sir. Thank you, Doctor.
Swimming or, I mean, because we cannot expect these older people, many of them.
No, water-based therapy is not swimming. Water-based therapy is like, there are elderly patients who is not able to carry their body weight to walk normally. So when you're going to walk in the water, when you're going to do any exercise in the water, it's very easy for them. If I ask them to climb the step for a senior citizen, it will be very difficult. If you have inside the water, you ask them to lift the knee, it will be very easy. It's just increasing the locomotor power of the muscles of all the joints, and walking in the water is they are not carrying the body weight. So the water carries, basically giving movements to all the joints, so that your muscles, your static and all the muscles, static forces act along with the water, is just helping you to do your exercise a little simple. That's what is the word.
Normal temperature water or any warm water is better?
Just normal temperature water should be fine. In the water temperature is not the it is not like you're having a chronic aches and then you put a hot water bath or ice pack. It's not like that. The water exercise is just to have the few locomotor functioning of all the geriatric population. And I tell them to lift the hand. For example, commonest thing geriatric, when they climb the car, they're going to be able to lift the leg and climb the car. Because they're not using much, 90 degree, they don't do it at all day-to-day activity, they're just doing a short gait. But if you're going to tell them to do that in water, easily they will do. So that time what happens, your hamstrings and quadriceps and soleus muscles start acting. So it's like, building a muscle, that's it.
Abroad I have seen patients are left in lukewarm water
so that it relaxes the joints and ligaments.
Definitely.
So that works better.
Abroad, the climate is always chill there. Here, Indian normal water itself is lukewarm
That's
water.
right.
That's what. They have temperature control pools. That's little, again, the budget of so many things are more. That's the reason.
Another thing, star triad features are osteoarthritis, sarcopenia, and tendinopathies. Which one do you encounter most out of these three features?
For what?
Which of the three features? The star triad comprises three factors.
All the, see, I will tell you it again, it's all patient based. If somebody is going to have tendinopathy, if elderly patient who is very active is still playing and doing things, he will land up only in this musculoskeletal tendinopathies or like that. Somebody who is sedentary will land up in osteoporosis. Somebody genetically or family based, they are not walking much, or obesity, they land up in osteoarthritis. So although there is a triad, a lot of discussion on the triad, I put it as the lifestyle of the patients lead to the disease of what they suffer. But definitely because of the loss of elastic function of the ligaments, loss of the muscles, definitely the geriatric population do have this musculoskeletal problems, which they can be addressed into that.
Okay.
Yeah, I'd like to congratulate for your comprehensive presentation on the various musculoskeletal problems an elderly person is facing. Because daily, day in and day out, senior citizens come with some sort of these issues. And we also try to offer non-pharmacological therapies. In the form of therapy, we have a physiotherapy wing attached to us. And it has got a major role, I should say, rather than before sending to orthopedicians like you. So they also want that, they like that, or they go for alternate medicines. So as far as the flexibility of joints you've been mentioning, and we also appreciate the joint flexibility should be maintained to the maximum possible extent in old age, and as rightly pointed out by Satyanarayana Raju, our functional capability should be maintained, and the aim of geriatric care is to maintain the functional ability. So as far as joint flexibility is concerned, do you advise yoga also for the persons who have not learned yoga until that age for a first time after 60 years?
It is quite tough because again somebody who has not done yoga for 60 years, or again you are going to flex them, they are going to have some muscle tears because the ligament is not as elastic as your young. So 50% of what the other normal people they do, even that is sufficient for them, because when you do beyond, then there comes a tendon ruptures, muscle ruptures, and the osteophytes in the joints break, the meniscal tears, they come with like that. So the flexibility has to come in a long way. Yes, they can do that, but instead of normal person doing it 1 month, it may take for elderly people who has not done yoga at all, it's going to take them for 6 months. So unfortunately, we cannot push them very hard to do it in a month. You have to give everybody enough time. You have a lot of measuring devices, the muscle bulk and muscle mass, all that. So we will know that, okay, this amount of muscle is enough for them to do the flexibilities. So before getting into the flexibilities, I would increase the muscle mass by doing some weights. Then later you put it to flexibility, it is very good. That's what I would, every individual is differently treated. That's what I put.
And another thing you said, they are not, the foot ground clearance is not adequate. That is the reason many a time they fall. This is how we also come across our patients who had an extraneous factor for falls. So in gait, do you suggest any modification or any precaution to be taken which we can advise the elders?
The gait training is very important. That itself is a big, huge topic. I think of one more thing to decide. But I just put the first itself, the gait cycle. And every gait cycle we have to look at it. It's not only the knee, if they have a knee problem, hip problem, spine problem, ankle problem, everything has a different gait. And we have to see the gait and know that, okay, he has got only spine problem because of he is having this gait, or he's got ankle issues, he is having this, heel strike is not there. So that's independently for every patient, it is different gait training is there. Most of the physiotherapists here, I think they will agree. They will usually concentrate on gait training is very important. Again, as you said, to increase the ground clearance, gait training is very important. We have to, that's as a separate subject here to discuss then. Only the recent thing is geriatric is since we have this a lot of orthobiologics things, that means we have this platelet rich plasma injections and we have this bone marrow injections. So bone marrow things. So these all the things can be help to reversal of the disease than going into the surgeries. That's one of the latest topics which we do it for all of them. Can take safe injections. It's not a painkiller. It's their own bone marrow.
Approximately
own
what
blood.
will be the cost for advising a biological cost? Approximately.
No, biologics for rheumatics, that's a different, it's a drug. This is a new topic. That means we, for example, we take a platelet rich plasma, we take our own blood and make the platelet, just only centrifuging it. It will cost you around 2,000, 3,000 rupees just injecting one of into the joint. If you're taking the bone marrow, make a bone marrow concentrate and injecting one of the few areas, it will cost little about 6,000 rupees, that's all. So these are taking your own blood, taking your own marrow and then treating yourself with the same thing. That's the thing.
Nice. Thank you. Thank you.